Hi, I'm Dr. Sharon Rasa, and one of the common questions that we get is, what do you do at Rasa Health, and what's involved with being a patient there? And I'm standing in front of one of my favorite pieces, not only because one of my patients painted this for me, but how this is called the peace flower, and how all of these overlapping petals actually remind me very much of how we think about the 5 levels of health and healing. So if you've looked at this chart, you know that we have a physical body, an energy body, a mental body, intuitive body. And it's not that it's not that any one of them is more important than the other, just like in this flower. This petal isn't any more important than this petal, but it's together that it creates the whole of nature and the perfection. So one of the questions that's on everyone's mind, you might consider as one of these petals, is what can I eat, or what can't I eat? And that's where I'm going to invite Mary Jo Kurtz, who has a broad background in holistic health, certified through the Institute of Integrative Medicine. She's a Reiki master and a very experienced and skilled holistic counselor and intuitive counselor in her own right. She's the one that we help our patients answer that question with. So here's Mary Jo.
Hi, I'm Mary Jo, and I'm here with Dr. Rasa today, and we're talking about what to expect when you come for your first visit. One of the questions that most of our patients come in and ask is, what can I eat? And it can be very difficult. We realize how difficult it is for everyone to know exactly what to eat, what's going to help them as they go through their healing process. So it's one of the things that I like to do with our patients, is to help them along the way. So something that Dr. Rasa has talked a lot about is bioindividuality, and how no two people are exactly the same. And so with that same theory holds true for how we approach food for our patients. No two patients are going to eat exactly the same way. And so this is really important. We can't just hand our patients a cookie cutter approach and say, here, eat this. So what we do is we spend the time with them to try to determine exactly what works for them. We use a lot of information based on their biochemistry, based on their test results, what different toxins they're working on, where they are in their healing process, whether they're in the clean out stage or the rebuild or the repair stage. And we use those to determine what foods will help them at that point in time. We also use our autonomic response testing to test out specific foods if it's necessary. So it's a pretty involved process, but it's one that we feel goes hand in hand with our patients' healing in this process. So since your first visit is such a long visit, we don't like to overwhelm anyone. And because food is something that's so critical and such an ongoing process, what we like to do is to have this running side by side with all of your other protocols. And so in your first visit, we'll talk about how we can make that happen so that we can do it in the most effective and efficient way for you to be successful.
Perhaps you remember in the earlier video, I mentioned the importance of addressing and understanding each patient's nervous system according to whether there might be sympathetic dominance or parasympathetic dominance. And one of the tools that we use in our office is called heart rate variability. So as Alex is resting on the table, you can see here on the graph, what's being measured is the distance between heartbeats. That is under the control of the autonomic nervous system. And the way that this software was developed, ideally, an optimal functioning of the nervous system, we hope to have a graph that looks like this. It's one of the ways that we track our patients' progress, and if we do not see this moving toward a more optimal function, then it's a real clue that something needs to change or we've missed something. So one of the important elements of that first visit is running the NEST scan. And this is the one that helps us understand and identify any imbalances that we find in the higher levels through the biofield. So in the model that we embrace, the 5 levels of health and healing, on the physical level, we must consider the structural component, the cardiovascular, the lymphatic, and the nervous system. But remember, the 5 levels of health and healing, and we move up the chart, now we're moving away from biochemistry more into the field of physics, and particularly light physics. And so if I wanted to give you a visual of what we might think about when we're thinking about how do we address the body from light physics, this is the picture we might consider. Each of us has our own biofield. And what's interesting about one of the properties of light is that it stores information. Maybe you've gone to an acupuncturist and you've learned about meridians. These lines in the body each can relate to a different organ system. Well, now the new technology, we have tools. In this case, this system is called NEST, and it's called Decoding the Human Body Field, the New Science of Information as Medicine. You watched Alex simply place her hand on that device and it recorded her biofield. Now we can go through and look at various screens and actually understand what's happening at the level of the biofield. And we consider this along with all of the other pieces, whether it's the patient's unique history, their biochemistry, and here their biofield. So whether you came to us through the Dr. Klinghardt lens, you probably have already heard him speak about the tool and technique that he developed, autonomic response testing. For those of you who came through our website, maybe you're hearing about it for the first time, and people get a little overwhelmed and anxious when they hear this word, autonomic response testing. But let me tell you a little bit about why it was even necessary to develop this tool. Dr. Klinghardt is a medical doctor and a PhD. He actually practices transcontinentally, and he has a unique perspective on patients. Sadly, what he was finding, he would take the same saliva, hair, or urine sample and send it to the same lab, and sometimes it would come back with 3 different responses. And that can be very frustrating to a practitioner who's trying to help their patient get well. So he started to think about how can we work with the system, this quantum cellular biological system. And he said through the system of light. What we're understanding is that our biochemistry and those bonds are actually regulated by physics. So using physics, we can actually see how there is either order or dysfunction in the biological system. And we do that through autonomic response testing. So Mary Jo is my assistant in the office doing autonomic response testing. And so instead of me using testing directly on the patient, what you'll see happen is Mary Jo will touch the patient and I will calibrate with Mary Jo. I'm using Mary Jo's arm, but I'm actually testing this patient. What we found is there's actually a geometric pattern or a resonance that seems to even make the testing even more precise. So there's 2 tools I'd like to introduce you to that Dr. Klinghardt created to incorporate when we're doing an evaluation with autonomic response testing. And one is a simple, we call it a pole filter, which is nothing more than a camera lens. Just as if you were taking a picture, you would rotate that lens to allow more light in or diminish that light. And the other he created is what we call a signal enhancer. This is a crystalline structure that actually acts as an amplifier. So instead of taking something that we're testing, whether it be a food or a pathogen, and placing it in the patient's mouth, all I need to do is simply take a vial of that substance, place it on the signal enhancer, and that signal is amplified and broadcast into the patient's system. I'm going to show you how we would use autonomic response testing directly and indirectly, and I'm going to start by how using it with Mary Jo. So if the patient has no injury to the arm and they're able to just have a simple strong arm and I ask her to resist, and she can. Now, of course, Mary Jo's strong, so she could push my arm up or I could push her arm down. The whole idea, and really the skill and the art with autonomic response testing, is creating a calibration. So I'm just going to ask Mary Jo to hold, and she can. So now I'm going to take the pole filter, and there's a whole science to this, which I'm not going to explain now, but there's a phenomena that occurs if the light emissions are coming off the body in an optimal fashion. When I ask Mary Jo to hold, a strong arm goes weak, and that we call open regulation. Now I'm going to show you how we would use that on the patient. So in this case, the patient is on the table. Mary Jo is touching the patient. Instead of using the patient's arm, I'm using Mary Jo's arm, and I'm going to start without the pole filter, and we have a strong arm, which is really good. Now I place the pole filter on, and I'm looking for a response. And hold, and I'm not getting the response that we would hope for in an optimal function. So what I would do now is I would stress or challenge different meridians. And as soon as I go to the liver, gallbladder, the test changed. So I already have a piece here that there's an imbalance in the patient's optimal function, or less than optimal function, in the liver, gallbladder. And it's a piece of information that gets put into our notes and we begin to understand. As we move forward through the testing, we can take vials of different pathogens, whether they be foods or bacteria or viruses, and you'll see that we actually test the patient not only directly on the body, but we actually test in the field. Because remember, in this model, we work with the biofield, and the biofield doesn't end here. It actually begins around here, and you'll begin to see us move through different layers. The higher my hand is up, the deeper in the cell we're looking. So the beauty of autonomic response testing is that you can use it as both a, quote, diagnostic tool and a treatment tool. So we just showed you how we might evaluate the system for what we call blocked regulation, or identify root cause of viruses, bacteria. So of course the question is, well, what are you going to do about it? So it's pretty simple. Here's a sample of a test kit that we have, and there might be everything in this kit from lymphatic drainage to liposomal formulas, or even homeopathics that work on an emotional level. What we know about the body is that there's a sequence to healing. And so what we have found useful is to use this template called Healing for the Pattern of Life. And in this very first quadrant, it says open systemic drainage, nutrient uptake, enzyme and colon health, hydration, pH, restore cellular communication. And so this is where it could get somewhat frustrating for a patient, because unlike in most doctor visits, you go in, you get a diagnosis, you get a solution, and you leave. Because we are dynamic and ever-changing, there is actually a sequence to healing. And the body has a priority. The quadrant that I just identified is the foundation. If the cell signaling is aberrant or chaotic, it doesn't matter how many wonderful remedies or how much good food you're eating, we have to establish that foundation. And that is typically what we like to do on that first visit. Obviously, there must be multiple follow-up visits to not only evaluate how that has changed and is the system regulating, but what is now the next step in that particular patient's healing. Again, looking at the 5 levels of health and healing, the 3rd level is the mental level, and then we call the 4th level the intuitive level. What we found is that we're really as sick as our deepest trauma, you might say. And so I'm not a psychologist and I'm not a licensed counselor, but we have tools that help us identify where trauma may be stored in the body and what emotions might be related to that. What you're seeing right now, we're using frequency-specific microcurrent, and there are many different protocols that, in this case, we might be doing a brain balance. We found, you certainly might be aware of, how color impacts healing. And again, using laser light, we can piggyback different flower remedies into the field that can begin to help that patient become connected with underlying traumas that may even be stored at an unconscious level. What we found is by identifying and releasing and working with them, it accelerates our patients' healing exponentially. Because the conditions that our patients are coming in with today can be challenging on so many levels, there is no one tool that works for everything. But one of the tools that we have found to be invaluable is something called pulsed electromagnetic field therapy. In fact, Dr. Oz called it the medical breakthrough of the 21st century because you can use it in a variety of ways, whether it's to eliminate pain, injury and trauma, stimulate bone repair, improve range of motion, detoxification, chronic fatigue, fibromyalgia, increase circulation, cellular health, and more. I like to have tools in our office that we can use in multiple situations. One of the ways that we use this is for lymphatic drainage and to help our patients detoxify. It is such a critical part of any health and healing. But of course, if you have a patient that is in pain, it doesn't matter how well you've gotten their food down right or how many remedies that you give them. So let me just show you what a simple PEMF session might look like. In this case, and with this particular device, the pulsed field can be delivered through these paddles and through the mat that the patient is sitting on. And we start very slow, and you'll begin to hear a sound. And you can start to see that the patient is actually, we call this cellular induced exercise. The beauty of this is that what we know about dis-ease is anywhere that the patient has pain, there's low pH. By simply providing the pulse in the area where the patient has pain or organ dysfunction, we supply that pulse. That helps to support pH. When we improve pH, we improve function. We thought it was important to create this video to help you get a visual of what it would be like to be a patient here. We certainly didn't have the time to introduce all of the tools, but I think I'd like to finish with helping you to understand, no matter what it is we're doing here, it's always with the same goal. And I like to use this little light because it says 100% life force. So when we are having access to 100% of our vital force, this is how we feel. We feel bright and energetic, and we have vitality and zest. But maybe the first time you come in, you're more like this. You just know that something's wrong. It's just not quite right, but you're not really sure. And along the way, we begin to remove some of the obstacles so that ultimately 100% of that life force returns. That cannot happen in one visit. So many patients will say, well, when do I need to come back and how often? There is no cookbook answer to that. Depending on how many layers are involved, how complex your case is, whether you're open and willing to address the emotional component, each one of these can be addressed in separate visits. So it really depends on patient compliability, schedules, budget, and what our common goal is: enriching optimal life force.